Here's a medical thing they don't tell you. Sometimes our treatment works so well for a cancer patient when we are not expecting it to work so well that we actually don't know what to do next. So, for example, let's say you're taking care of someone that has stage 4 colon cancer, and let's say with all the different variables, their life expectancy is supposed to be 2 to 3 years. You start to give treatment, you know that they're going to be on chemotherapy, immunotherapy for those 2 to 3 years, hopefully to get that cancer not to grow as much. But then you get to the 3 year mark, right? And then you decide, well, what's next? And the way that guidelines are written, in some cases, if you're given certain regimens, you're supposed to continue the regimen, the chemotherapy, the immunotherapy indefinitely. So you're pretty much committing this patient to chemotherapy or immunotherapy forever because you expected this patient not to be able to survive for those 3 or 4 years, but now all of a sudden they're at year 6 and you have to decide, well, do I continue to give them this chemotherapy? On the one hand, it's kept the cancer at bay. On the other hand, chemotherapy has its own toxicities. So the issue becomes, well, if I stop this therapy, is the cancer going to come back? But if I continue with this therapy, are they going to get neuropathy or some other side effect that's unbearable? That's a very tricky situation. There aren't enough trials to tell us what to do when the patient responds too well to the therapy we give them.